Hi, Cara. Thank you for joining us this evening.
Hi Gemma, thanks for asking me.
Oh, you're very welcome. We're very honoured because I know time is very, very precious, especially in the evenings. And so tonight we have got a very exciting announcement. Um, I've just realised we did discuss who was going to do the announcement. So shall I just go with it?
Go for it, go on.
Lovely. So we are very, very excited to have been fortunately the recipients of a very generous donation from a lovely, lovely local family who are going to, or who have funded some very much needed training. The Giles family have very kindly donated this money to us, and that has allowed us to accredit a very special course that you've written, Cara.
Yes, that's right. So the training, so it's training that we're delivering, and it will be to sonographers across all of the University Sussex hospitals. So that includes Princess Royal, the Royal Sussex, and Worthing. So the training is breaking difficult news. So it's all about helping sonographers, and I think there might be some nurses and midwives invited as well, but helping them with the most sensitive delivery in helping families who might get difficult news at scans, whether that be about abnormalities, finding out there's no heartbeat, whatever that difficult news is, helping staff know exactly how to deliver that in a way that is most mindful and supportive of the families is the important.
That's wonderful. And I think that the role that we both have over and above our charity roles, we are very aware of how important and how necessary this training is. Would you agree in your field of work as well?
Yeah, absolutely. I mean, I speak to people every day, and some people say, how much the sonographers or the people who delivered kind of difficult news to them were brilliant and supportive, and what a difference that made to them, and how much kind of comfort that brought to them. And likewise, I hear stories of people saying that it was delivered in a way that was less sensitive or more medical, or just not particularly helpful for the person. And part of this training is about exactly that, working out what's right for the person in front. So there's not an exact formula. How I would like to have been told might have been different how you might have liked to have been told. But so the idea is to how can you meet the needs of the person in front of you. So I think it's really, really important. And as I say, I hear both sides of that. I hear how much comfort that can bring and how much distress it can cause when it's not delivered in a sensitive way, or that support is not given. Um, so the training is about helping delivery of it, but there's also an aspect in the training of looking at the psychological impact of baby loss itself, and what factors affect coping. So it's not just about the words used, but also helping staff who work in the area to really understand the impact of loss and what factors might play a part in that, and how integral their role is to coping. Because actually, the better supported someone is in those initial stages, the better they're likely to be able to cope later on. So there's a really integral role that these staff play, and sometimes they might not actually have been trained to know how to do that. A lot of people will say they're kind of learning on the job, and that's hit and miss whether or not that's right. So this, I think, is really, really important, that we can say, okay, we can't expect you to always know what's right, but with training, hopefully we can help you to be able to really understand and deliver the process sensitively and so.
Absolutely. And I think in any role, whatever job people are doing, you can't have enough training. The nature of baby loss is an extremely sensitive topic and journey and experience. And like you said, it's not one size fits all. What's right for one family, it might not be right for another. What's right for you might not have been right for me. But it's having those tools in your toolbox almost, isn't it? That you can almost learn to read the room almost to know. Okay, well, might need to adapt in this way for this patient. Would you say that's correct?
Yeah, absolutely. So the training involves some kind of ideas of things that are often helpful and things that are often less helpful, but it is also about, absolutely reading the room, and also knowing someone's history, or if it might be that some people will overtly tell you what they want and need. So sometimes it's about listening. There's, you know, a few different indicators that people might know. There's also a section within the training looking at kind of practical information that might be helpful to tell families, where you might signpost them onto. So we don't expect people delivering bad news to be doing all of the support all the way through. Obviously, they have a section to play, but where else might they signpost to, where else might be helpful. And another part of the training looks at how we can support partners and making sure that partners are also recognised, acknowledged, and kind of seen in scans and considered in terms of their needs as well. So obviously we don't know a partner's history, we don't know how triggering or traumatic or difficult that might be for a partner. Often, you know, medical staff might have some of the notes of the patient in front of them, but they might not have anything about a partner. So it's remembering to consider the partner, basic things like remembering to make eye contact, to ask how they are, acknowledging both people in the room rather than just speaking to the patient in front of them. So yeah, lots of things to make sure that partners are also included, because that's another thing I hear a lot, is that sometimes men don't feel acknowledged or considered, or if they've been quite traumatized by a loss, seeing someone again on a bed for a scan and hearing kind of the sounds of monitors, etc., can be quite triggering. So yeah, just really considering both people in the room, assuming it is a couple at the scan. You know, I'm aware that's not always.
Absolutely. I mean, there's been situations where I know moms have taken their mother in with them, because it is just too triggering for their partner, and they just don't feel able to sit through the worry and the concern until they know that there's a heartbeat. I know recently a gentleman reached out and he said that even though he knew there was a heartbeat at the scan, that was how it was last time. It was when they then got home. So there is also that wider context of partners can be anyone. It can be the person that's accompanying them to the scan, if they have someone accompanying them, and that's huge. That's absolutely huge for support going forwards, and being able to share in that partnership with whoever it is that's attending the scan with them.
Yeah, absolutely. And within the training, there are case examples that people have kind of said, please do use our example, where people have talked about scans that have been helpful, they felt were really supportive, and that news has been delivered well, and they felt that the sonographer was empathic, etc. And examples where people have come away feeling like they wished they'd had a slightly different experience. So just to demonstrate really to the sonographers just ideas of things that might be helpful, or how they might read the room a little bit. So yeah, there are kind of practical examples within that as well. And then the kind of conclusion of the training is looking at staff wellbeing themselves and how the staff can support themselves working in the area. There's lots of research to say that sometimes empathy reduces and compassion reduces for patients when actually staff feel burnout, stressed or overwhelmed, or find things difficult themselves. So it's really important to look at staff wellbeing as part of this training and not forget the staff within that, because I think that benefits both the patient and the staff.
So important, so important, and I love that encompasses all elements. It's not just driven to focus on one particular topic. It is all encompassing, and that's so important because they are all the people that are in that scan at the time, and potentially walking away from that scan afterwards. And I'm sure, having spoken to lots of sonographers over the years, that it's traumatic for them as well, delivering that news. So this will give them tools in their toolbox that will help them have an understanding of the wider context, as well as how they can look after themselves as well. Thank you, Laurie. You have written this training, and I cannot wait to see it being delivered and rolled out. And obviously this has all been made possible because of the really generous funding in honour of Pierre Oliver Giles, which is just incredible, and also your dedication and passion, Cara, to this community. And I just want to say a massive thank you for that, because it's one thing writing this for for an audience, but it's also one thing writing this when you have your own experience as well. So thank you so much for taking the time to do that.
No worries at all. It's an honour to be asked and to help and support the rest of the baby loss community too.
Thank you so much. Well, thank you for your time this evening. I hope that this exciting news will be really well received, and we will keep people updated as and when we're able to launch dates.
Yes, absolutely. Thanks, Jen.
Thank you, Carl. Speak soon.
Bye.
Bye.